Over the past year, masks have been a part of all of our wardrobes. Masks have been used for a very long time during surgeries and other medical procedures. Throughout the pandemic, masks or facial coverings have been required all around the world. We simply don't even hesitate when going somewhere, we just grab a mask. But why? What is a facial covering doing to help us? We all have wondered this every time we wear a mask. The truth is, the mandates and guidelines are actually very helpful and protect us. They protect us in many, many ways as well as the others around us. Today, I'll share with you how masks are effective, the statistical studies of masks, as well as some additional things to do while wearing a mask. The sole purpose of facial coverings is, especially going through a pandemic like today, is to reduce the spread of the virus and infections. Masks protect us from other people and other people from us. Masks act as a barrier to prevent respiratory droplets from your nose and mouth from reaching the others around you. A simple phrase or sentence spoken allows anywhere from 20 to 500 droplets to be passed, says Ching Hong, who is a medical doctor and professor in the health division of infectious diseases. These droplets can be passed just by talking, as previously mentioned, also by sneezing and coughing. Masks help to reduce and prevent the inhalation of these respiratory droplets. Masks not only help to slow and prevent the passing of droplets, but sometimes people have no symptoms. Many people have no idea that they are even sick. However, pre-symptomatic and asymptomatic transmission is still possible, says Ernest. Wearing a mask keeps you from spreading an illness while not having symptoms. Now let's look at some statistical evidence that proves mask effectiveness. For obvious reasons, there have been several, probably hundreds of studies and experiments over masks just in the past year alone. The CDC, along with many universities all around the world, have been experimenting how effective facial coverings actually are. One example for a study was published in Health Affairs magazine, compared the growth rate for COVID before and after mask mandates. The study includes 15 different states dispersed throughout the United States. The study revealed that mask mandates led to a slower daily growth rate, in which is still very apparent. Rutherford, also a medical doctor, commented on this study, stating that growth rates slowed by 0.9% after only 5 days of mask mandates. By week 3 of mask mandates, the growth percentage had slowed by 2 percent points. To add, another accidental study was done in May of 2020 throughout a hair styling shop. 2 hairstylists had close contact with over 140 mask clients. The stylists at the time of exposure were asymptomatic but later tested positive for COVID. None of the 140 mask clients contracted the virus. These studies lead to scientific support and other theories. Barack Fishoff, a PhD of science, says that science supports using masks based off of recent studies and suggests that they could save lives in many different ways. Another simple scientific example is that at several protests throughout the United States, no COVID-19 spikes were made in the daily growth because most of these attendants wore masks. However, to compare to this, at a summer camp in July of 2020, where children were not required to wear a mask, a large spike increased in the daily growth rate of COVID. Throughout the months of April and May, when the U.S. mandated masks, researchers estimated that the growth rates for COVID-19 were reduced by 2 percent points per day. The University of Hong Kong conducted a study on rats, some infected, some masked, and the remainder were healthy with no mask. This study showed that only 1/4 of the masked animals contracted the virus, and 2/3 of those unmasked healthy rats contracted it. While science and other studies prove masks to be effective alone, they also suggest a few other hygienical tips to reduce your risk after being in a public area. Chin Hong came up with the 3 W's to ward off COVID. These include wearing a mask, washing your hands, and watching your distance. Wearing a mask has been proven to be highly effective in slowing the spread of infection. It has been logically and scientifically proven through studies and experiments that they protect us from close contact. Chin Hong's second tip is to wash your hands. This is common sense for any day, but should be stressed especially during a pandemic. Fishoff adds that the worst thing that could happen for frequent hand washing is the dryness of hands. Washing your hands reduces the spread of germs from contaminated surfaces to areas on the face. It is highly recommended to wash your hands after being in public and always before you're touching your eyes, nose, or mouth. Lastly, Hong recommends watching your distance. Keeping a safe distance makes respiratory droplets have further to travel in order to reach you. Even with social distancing and small gathering, masks are still highly recommended. To conclude, we are all aware of the hassle and uncomfortableness of masks. However, they have been proven to be effective in reducing the spread of respiratory droplets since they act as a barrier. Daily percentage drops after mask mandates were dramatic, which proves that masks increase our health. Several studies and experiments give evidence of their effectiveness, while taking a few extra precautionary steps also reduces your risk of cross-contamination, such as simply washing your hands.